It's always great for us to have the opportunity to come and chat with you folks. We like the opportunity to let you guys know kind of what new things we have coming down the pipeline and what are the new things that we're up to in terms of research and new advancements. So we really enjoy it. So again, thanks for letting me come and chat with you today. I'm going to talk to you today about a really exciting new advancement in prostate cancer. It's a really powerful new tool that really helps us to better manage and make better decisions in terms of how to manage people's prostate cancer. And this tool is called PSMA-PET imaging, or you can call it prostate PET imaging. And I know this is, even though it's relatively new, word of this has gotten around quite quickly. I know in my practice, I'm regularly asked by new patients that are coming to the clinic about, whether they can get a PET scan, where can they get a PET scan, and what the value of a PET scan in their cancer is. And so I'm hoping that some of those questions will be answered by this talk. Now, the topic of PSMA PET scans, it's a very complex topic. It's a very technical topic with lots of studies, with lots of complex numbers and results. And so my goal is I tried to sift that down to a fairly basic talk. What I'm hoping to get across is just get you an idea of what PSMA PET imaging is, how it compares to the typical imaging that we do for prostate cancer, and that would be CAT scans and bone scans. And most of all, I want to give you an idea of how PSMA PET scanning can improve care for those men that have prostate cancer. And so just as an introduction, as you all know, prostate cancer is the most commonly diagnosed solid cancer in men in Canada. It makes up about 20% of all cancer diagnoses in Canada in men. And in 2019, almost 22,000 men were diagnosed with prostate cancer. It's also the third most common cause of cancer death in men in Canada, and makes up about 10% of cancer deaths in Canada. And so that in 2019, that was about 4,100 men who unfortunately passed away from prostate cancer. When prostate cancer is localized just to the prostate gland and hasn't spread anywhere, we have very effective treatment options that are potentially curative. And you guys all know that most of you are familiar with these options. The standard options in 2021 would include surgery called a radical prostatectomy, external beam radiation treatment, where radiation is delivered from the outside, and brachytherapy, where we implant radioactive sources into the prostate gland. Now, all three of these options are very effective at treating and curing prostate cancer. But despite that, despite these effective treatments, up to 40% of men will suffer a recurrence of the prostate cancer, despite having one of these curative intent treatments. And so, in order to understand how useful PSMA PET scan imaging is, it's important to understand, why does prostate cancer recur? If our treatments are as effective as I say they are, why does the cancer come back? Why does this happen? And so I want to explain that a little bit. Why cancers recur despite effective treatment. In this case, I'm talking mostly about radiation treatments, but it's equally applicable to why cancers recur after other treatments. And there's really, this diagram shows one of the two mechanisms or scenarios in which prostate cancer can recur. So this, in this diagram, this is a gentleman with prostate cancer. Here's his prostate right here. And this man goes to the clinic, and before having treatment, we put this gentleman through scans, conventional imaging. In this case, CAT scans and bone scans. And the goal of those scans are to see whether his cancer has spread or not. And so this gentleman undergoes these regular conventional scans, and the scans show no evidence that the cancer has spread. So because of that, we figure that he's potentially curable with treatment, and he undergoes radiation treatment to the prostate gland here. And in this case, the radiation treatment is actually quite successful. It eliminates the cancer in the prostate gland. But unfortunately, it turns out that even though our scans before treatment had suggested there was no spread of the cancer, those scans are far from perfect. And in actuality, this gentleman actually did have, in this case, two spots of cancer that had spread to the bones here. And those spots of cancer that were in the bones were there before he had radiation treatment. They were just too small to show up on our regular imaging. And so in this case, even though the radiation was quite successful at eliminating the cancer in the gland, there were these two spots that we did not know about, that we're unaware of. And therefore, this man subsequently has progression or recurrence, I guess you could say, of his cancer fairly early on after completing his radiation treatment. And so basically in this situation, the cancer has recurred or the cancer has progressed despite treatment, basically because the horse was out of the barn door before we started. The cancer had already spread, but our scans were just not sensitive to pick that up. And we think this mechanism of treatment failure is what's responsible for men whose cancer recurs fairly early after treatment, say within the first 4 or 5 years of treatment. So this is a very common problem that we see in clinic. And in this particular situation, if we were to have better imaging that's better than bone scans or CAT scans, we can reduce this type of recurrence. In this situation, if instead of having conventional bone scans or CAT scans, if we had scans that were more sensitive and could pick this up, then a man that we know has cancer has spread from the get-go would then travel down a different pathway appropriate for men whose cancer is spread, and we wouldn't have we would reduce the number of men who have radical treatments that are unsuccessful in the first early on in the first 4 years. So this kind of scenario, this kind of mechanism of treatment failure, we can reduce if we have better imaging. There's a second way that people fail radiation treatment for prostate cancer. And in this scenario, again, we have a similar kind of gentleman who has prostate cancer in his gland, and he has a bone scan and CAT scan, the regular scans. And again, they don't show any evidence that the cancer has spread. So he has radiation treatment to his prostate gland. His radiation treatment is initially quite effective. The prostate gland shrinks, the cancer shrinks down, and things look good in the first few years after treatment. But then at some point down the line, the cancer in the prostate gland starts to grow again, presumably because, a few small cells of prostate cancer were able to survive the radiation treatment. And so, years down the line, the cancer in the prostate starts to grow again. And eventually it grows to a sufficient extent that over here, it can then spread to other areas, in this case, to the bone. So in this case, the scans got it right. And before treatment, there was no cancer that had spread before the radiation treatment. It's just that the radiation treatment wasn't entirely successful at eradicating the cancer in the gland. And eventually it grew back in the prostate gland and then spreads to other areas. This mechanism of treatment failure, we think, is responsible for recurrences that happen later. So a man whose cancer comes back, say, 10, 12, 13 years after treatment. And unlike the last type of treatment, the last kind of failure I told you about, this type of treatment failure, it wouldn't matter if we had better imaging. That wasn't the problem. The problem with this kind of treatment failure is we need better treatment. Better treatment to completely eliminate the cancer in the gland so it doesn't come back. And we're certainly working on that, in terms of ways to give higher doses of radiation, ways to combine medicines with radiation, that area is certainly moving forward. But even still, even though better imaging wouldn't necessarily prevent this kind of problem from happening, it still is useful. Better imaging in this kind of failure is still useful because once the person fails treatment, better imaging would be able to detect that failure sooner so that salvage treatments can therefore be more successful. So, there's two different mechanisms, both of which I think do benefit from better imaging, but just in different ways. And so the bottom line is we need better imaging to detect cancer spread. Our conventional imaging, which is CAT scans and bone scans, are very limited in identifying the sites of cancer spread. And to put simply, it's difficult for us to treat what we can't see. And so this very limited abilities of conventional imaging, CTs and bone scan, is really a major barrier to provide for us to be able to provide optimal treatment and improve survival and quality of life for men with prostate cancer. So the good news is there is better imaging that has been developed, and PSMA-PET is one of these new and better forms of imaging. What PSMA-PET scan is basically a form of advanced imaging for prostate cancer, which I'll explain in the later slides. But what PSMA-PET imaging does is it provides us with two types of information. It gives us anatomic information, and what that means is it tells us where the prostate cancer disease is located within the body and how much there is. And the other thing is it gives us functional information. And what that means is if a spot lights up if something in the body lights up on a PSMA-PET scan, most likely that spot that's lighting up is prostate cancer. It's a very specific to prostate cancer. It's not going to be some benign finding that looks like cancer, or it's not going to be some other kind of cancer even. Things that light up on PET scan are almost, the vast majority of the time are spots of prostate cancer. So it tells us where the cancer it is, and it confirms to us that it is indeed prostate cancer for the most part. So what is PSMA? And so what PSMA stands for? PSMA stands for prostate specific membrane antigen. And what this is it's a protein or an enzyme that's located on the surface of prostate cells. So here's the surface of a prostate cell, and here's this protein or enzyme that sits there. We don't really know what it does, but what's important is it's located on prostate cancer cells at much, much higher concentrations than it is in normal prostate cells or other kinds of cells. And so that makes it very useful as a powerful biomarker for prostate cancer. And so what we can do to take advantage of this is we can use it for imaging. And the way the PET scan imaging works is we have this molecule that's called PSMA-11. And what this molecule can do is it can stick to the PSMA receptor. So what we do is we tag this molecule with a radioactive compound. In this case, it's called gallium-68. And we inject this into the body, and it travels through the body, and this PSMA-11 molecule finds and sticks to the PSMA receptors that are located on prostate cancer cells. When it binds to the receptor, it gets brought into the prostate cancer cell. And once it's inside the prostate cancer cell, this radioactive gallium component decays, it undergoes radioactive decay and releases two photons, forms of radiation. And those two particles of radiation are picked up by detectors on the PET scan. And that way the PET scanner is able to trace back where those radiation particles came from in the cancer cell. So it can give us an idea, it can tell us quite precisely where the prostate cancer cell or the prostate cancer is in somebody's body. So in a nutshell, that's how the PET scans work. This is the outcome of it. So this is an image, a PSMA-PET image. And so what this shows is someone's body looking straight at the person. And this here is their backbone. These two things are their kidneys. And spots that are lighting up, other than the kidneys, are spots of cancer. So you can see here, this is the pelvis, and you can see there's a few spots here that are lighting up. And these are spots of prostate cancer that have spread to the bone. In this case, in the person's leg, the femur, the pelvis, and around. So this is what a PET scan looks like. So this is what I mean. It tells us anatomic information where a spot of cancer is, in this case here, say in the top of the leg. And also it tells us functional information. It tells us that these spots that are lighting up are almost certainly spots of prostate cancer, not some other, benign finding or something else. So then the next issue is, how does PSMA-PET compare to the regular imaging that we do for prostate cancer? And the regular imaging being CAT scans or bone scans or even MRI. And this has been looked at, and this was a study that was done looking at exactly this question, comparing PSMA-PET scans with regular CAT scans and bone scans in men with prostate cancer who were considering surgery to cure it. And this was published in one of the major medical journals, The Lancet. And so they compared head to head which was better at picking up whether someone's cancer had spread at diagnosis. And I don't want to go through, it's, again, like I said, it's very complicated, complicated stuff, but, to distilling it down, what they found was the PSMA-PET scan was much, much more sensitive at detecting areas of cancer, that prostate cancer that had spread, than conventional imaging, CT and bone scan. And so what they found was, these are the numbers of the sensitivity. The PET scan is 85% sensitive versus 38% sensitive for regular imaging. And what that means is, if I had 100 men who in fact had cancer that had spread, and I scanned them, the regular CT and bone scan would only pick up the cancer that had spread, the cancer had spread in about 38% of them. So we would miss it in a lot of them. Whereas with the PET scan, if I took those same men with 100 men that had cancer that had spread, it would pick it up in about 85% of men. So, when I first read this was a real wake-up call. What this tells me is that, all these years we've been scanning people with CT and bone scan, and we've been missing a lot of cancer that spread in a lot of men. And the PSMA-PET imaging would, really make a big impact in picking up, accurately men whose cancer had spread. It's also more specific. And basically, again, if I had, what that means is, if I had 100 people whose cancer had not spread and imaged them, the PSMA-PET scan would show that there was no spread in almost 100% of the patients, whereas the CT and bone scan, not so much, more like 90%. And when we put this all together, the bottom line is the PSMA-PET is much more accurate than regular CT and bone scan, 92% versus 65%. So about 30% more likely to distinguish people whose cancer has spread from those whose cancer has not spread. So I know that that's a bit complicated, but I think the bottom line is the PET scan has been demonstrated to really be much more effective at picking up men whose cancer has spread compared to the regular imaging. And so why is this important? Why do we want to pick up early on if someone's cancer has spread? Well, one of the most important things is it reduces, by picking this up and more accurately, it reduces the number of men that we subject to treatments that aren't going to help them, and that will just cause them side effects. If someone has prostate cancer that has actually spread at the get-go, then it's not going to be cured with surgery or radiotherapy or brachytherapy. And so putting those men through those types of treatments just subjects them to the side effects of those treatments without the possibility of cure. So by having PSMA-PET imaging, we can really better select who should go on to have curative treatment, and which patients that we may not be able to cure, but at least we can, divert them over to a more appropriate treatment for men whose cancer is spread. And that gets to my second point, is by better identifying men whose cancer is spread, we improve outcomes. Because, that way, if we know from the get-go that somebody's cancer has spread, then we can give them the most appropriate treatment for cancer that has spread. And this might be medical therapy, some of our new advanced medical treatments we have. This might be precision radiotherapy to target those areas where the cancer is spread. But the bottom line, by giving them the treatment that's appropriate for cancer that is spread, we can improve outcomes. And then finally, the last way that PSMA-PET imaging is important is sometimes with our regular scans, we're looking to see if someone's cancer is spread and we see something, say in a bone, but the CAT scan, the bone scan says that there's something there, but we don't know what it is. It could be a spot of prostate cancer. It could be some benign finding, like a scar tissue in a bone or something, and we can't tell. And in those instances, because the PET scan is so specific for prostate cancer, by doing the PET scan, we can find out, what these uncertain spots are. It can give us answers sometimes when there's a spot and we don't know what it is. So this is an example here. And so this is actually a patient that I had. This is a patient that was had diagnosed with prostate cancer and had undergone the regular CAT scan and bone scan, and they didn't show any evidence that the cancer has spread. So he was actually booked to have surgery, a radical prostatectomy. Fortunately, about 2 weeks prior to his surgery, he managed to get in for a PET scan. And this is his PET scan, and this is his body in cross section. So this is his backbone, up here is his belly. And what this scan showed, these little dots here, it showed that this man's cancer had actually spread to the lymph nodes in the back of the belly. And actually, on a different picture, it had actually spread to one of his bones as well. And this spread had not been appreciated on his CT imaging or his bone scan. And so fortunately, this man had this scan done prior to surgery. So we were able to, tell him that and inform him that, surgery is not going to be curative. And so fortunately, he was spared having the surgery. And instead of having surgery, went down an alternate pathway with treatments that are more appropriate for someone whose cancer has spread. And so, in this situation, the PET scan made a big difference. For him, surgery would not have been curative. So he avoided, the risks of surgery. Anytime you have a big surgery, there's risks from the anesthetic, risks of bleeding, blood clots, infection, side effects that can happen with surgery, incontinence and erectile dysfunction, not to mention the 6 to 8 week recovery period after that. And probably more importantly, he was, like I said, he was started on the more appropriate medical therapy, because if he had had just surgery, his treatment would have been incomplete, because he would have had the prostate gland removed, but this disease here that we didn't know about wouldn't have been treated. Now that we know, we can give him treatment that's going to treat all of his cancer. It may not be curable, but his ultimate outcome will be superior because we're treating him the proper way. So that's the first kind of set of circumstances where we find that PSMA PET scans are very useful in surveying someone who's just been diagnosed with cancer to see if there's cancer has spread, and to allow us to make better recommendations and better decisions for treatment. The second situation where PET scans are useful is when someone's cancer comes back. And as I said before, even though we have these, great potentially curative treatments, somewhere around 40% of men treated for cure will have the cancer return at some point despite the treatment. Nowadays, recurrences, when someone's cancer comes back, it's generally detected relatively early because of PSA testing. As you guys know, if you have, say, surgery or radiation treatment, after the treatment, if it's successful, the PSA goes down very low, and the PSA blood test, and we keep an eye on it. And if down the line the PSA goes up and rises, that signals us very early that the cancer has come back somewhere. But the problem is that the PSA blood test, it may tell us early if someone's cancer has come back, but it doesn't tell us where the person's cancer has come back. And if we're going to salvage that person, hopefully for cure, we need to know where that spot or those spots of cancer are. And ideally, we need to know it early when the PSA is quite low, because some of these men can still be cured if we can identify where the cancer has come back and treat them appropriately. But our chances of successful cure or successful salvage are better if we can do it when someone's early on, when someone's PSA is low. So the problem is when someone's PSA is low, the conventional imaging, bone scans and CT scans are lousy at picking up where the cancer is. You know, someone's PSA might go up to 3 after they've had treatments telling me that their cancer has come back. But when I send them for a PSA, for a bone scan or a CAT scan, those scans most of the time won't show anything because a bone scan has a very low chance of detecting recurrent cancer if the PSA is less than 10. And even a CAT scan has a very low chance of detecting cancer if the PSA is below, 10 or 12. So it really doesn't help us, these imaging, conventional imaging doesn't really help us that much in finding where this site of recurrence is. But that's very important because, as I said, if we can give salvage treatment when the PSA is low, our chances of cure are much better. These numbers don't matter, but if someone, say, had surgery and then their cancer comes back, their PSA goes up after surgery, if we try to salvage that for cure with radiation treatment, the chances of cure are much higher, are much better if the PSA is low. Similarly, if someone had, say, external radiation treatment and the cancer comes back after treatment, again, we can salvage that with brachytherapy with very good results if we do it when the PSA is low, as opposed to when the PSA is high. So having imaging that can tell us where this cancer has come back when the PSA is low is critical, and CT and bone scans are quite poor at that. But PSMA-PET imaging is good at it. This shows, how likely the PSMA-PET scan is to pick up a spot of recurrent cancer at different PSA levels. And even at a PSA as low as 0.5, which most of you men know is extremely low, it still will pick up a spot of cancer about 40% of the time. And when you get up to low levels of PSA, a PSA between 1 and 2, it'll pick up where that site of recurrence is the vast majority of time. And so, if someone's cancer comes back as evidenced by a rise in the PSA, if I put them through a PET scan, there's a good chance I'm going to be able to find out where that site of recurrence is. And some of those men, if I know where the recurrence is, some of those men may still be curable with the appropriate treatment. And here's an example of just this situation. This was a man, I've known this gentleman for a long time. I met him initially when he was 60 years old. And when I first met him, he had a localized prostate cancer. So the scans, the regular scans didn't show any evidence of spread, but his cancer was considered to be fairly high risk. It had a high Gleason score, the high grade. It was a high risk cancer. And so he underwent treatment with external beam radiation treatment, and he had hormone therapy as well for somewhere around 18 months. And he had an excellent response with no evidence of disease after treatment. And his PSA went down to close to 0 and stayed there for 10 years. He did very well. But unfortunately, 10 years later, his PSA rose up to about 5. And not surprisingly, so when we went to go look to see, okay, well, where is the cancer? We put him through CT scan, a bone scan, an MRI, and not surprisingly, from the data I showed you before, those scans didn't show anything because they're poor at finding cancer at a PSA as low as 5. Fortunately, this man was able to have a PSMA-PET scan, and it showed that the cancer had recurred only in one tiny little spot here within the prostate gland. Fortunately, there was no sign of any cancer anywhere else, just this one spot that you can see here lighting up. This is the prostate gland here, this is the rectum here, and this little yellow spot here is a tiny spot of recurrent cancer in the gland. And we biopsied that to confirm that actually was a recurrence of his cancer. And so in this case, the PET scan provided us crucial information that allowed us to go on to give him curative salvage treatment. It told us, 1, where the site of recurrence it was, in this case, in the prostate gland. 2, it confirmed to us that there was no spread outside of the prostate gland. The PET scan didn't light up anywhere else. And so that's important because it tells us that this man can still be cured even though his cancer has come back. And the third thing is it provided us a very precise location of where his disease was. And this allowed us to do something very special for him. Because we knew exactly where it was and just a little tiny spot there, we were able to take him to the operating room and do what we call focal brachytherapy. Basically just put the brachytherapy seeds just in that little area of the prostate gland where the cancer had come back, rather than planting the seeds throughout the whole gland, which is what we usually do. And so this is how it looked in the end. Here's his prostate gland here, here's his rectum. This red spot is where the cancer was, and these little white things are the brachytherapy seeds that we were just able to place just in that one area where the cancer had come back, instead of putting them all over the gland, which is what's usually done. And these little lines here, this green line shows where the high dose of radiation is. So we were able to treat that. This gentleman had a complete response to his salvage brachytherapy. And because we were able to do this very focused little brachytherapy implant just to the one area instead of the whole gland, he had almost no side effects to this treatment. He got through it very easily with no real adverse effects to the bladder or the bowel or anything. So he had a complete response. His PSA has gone down to close to 0, and he's doing very well. And this would have really not been possible without a PSMA-PET scan. There's one last situation I want to tell you about, and this is men who, sometimes, or in the situation I just told you about, his cancer recurred only in the prostate gland, and he was curable. Sometimes men will have the cancer come back somewhere outside of the pelvis, maybe in a bone somewhere or a lymph node somewhere. And some of those men, even though the cancer has come back somewhere distant from the prostate gland, if they only have maybe 1 or 2 or 3 spots of cancer outside of the pelvis, they may still be potentially curable with very focused, what we call precision radiation treatment. And even in these men whose cancer recurs, outside of the pelvis in 1 or 2 or 3 spots, we find that PSMA-PET imaging makes a big difference. If we have somebody whose cancer has come back in only a couple of spots outside of the pelvis, if we find those spots using conventional imaging, CT or bone scan, most of them don't end up being cured. Most of them end up having the cancer returns, within 6 months, probably because the CT and bone scan are so poor. Even though they only show 1 or 2 or 3 spots, there's many more that we aren't seeing on the scan. But if we were to take if we were to look for those spots of cancer with a PET scan, and then give them precision radiation to those spots that it finds, the majority of them are free of cancer, 3 years out. And that's because, when the PSMA-PET scan tells us there's only 1 or 2 or 3 spots, most of the time there really is only 1 or 2 or 3 spots, not more that we can't see. So even in some men whose cancer comes back distant from the prostate, PSMA-PET scan imaging can help us to provide potentially curative treatment in that situation, or salvage in that situation. And here's an example of that. This is another man that I saw. This is a 70-year-old gentleman who had surgery for prostate cancer in 2016, and he did well. He had his surgery, and then soon after the surgery, he actually had radiation treatment to the area where the surgery had been done, because his PSA hadn't gone quite to 0. So initially, he had surgery and radiation treatment in 2016. He did well for a few years, but in 2020, his PSA went up, not too high, less than 1, but still high enough that we knew that his cancer had come back somewhere. We just didn't know where. He had a CT scan and a bone scan and MRI, and none of those scans showed anything. And so prior to PSMA-PET imaging, this sort of gentleman, we would have done the scans, not seen anything, and we would have said, well, probably he's got cancer all over the place. It's just too small for us to see. And we would call this is what we would call a biochemical recurrence. And we would say, well, this is an incurable situation, and the standard treatment would be, lifelong hormone therapy. Maybe not quite started yet, but at some point, and the person would go on hormone therapy either intermittently or continuously. And we would sort of throw in the towel and say, we can't cure the situation. But now things are different. This man had a PSMA-PET scan, and the PET scan showed that the cancer had come back only in one spot, in this case, outside of the pelvis. So this is the patient here. He's lying on his back, and this is cross section. So this is his heart here. This is his liver here. And you can see right here, this is his backbone. There's one tiny little spot where the PSMA-PET is lighting up here in the backbone. And so the scan showed that he had only one spot of cancer that had come back, and it had come back in just this one bone, the T8 vertebra, and nowhere else. And so in this case, because we knew where it was early on, we're able to target this spot with what we call precision radiation treatment. In this case, it's called stereotactic ablative radiotherapy, just a very advanced targeted way to give radiation treatment just to that one bone. And so he had this treatment, and that was a while back. His PSA went down to 0, has become undetectable, and since then he's had no evidence of disease. We're hoping that he's cured. It looks good right now. Only time will tell for sure. But certainly, before having this sort of imaging, we wouldn't have even had the possibility of curing someone whose cancer had come back like this. So I hope, I know that's a complicated topic, and I hope that in sort of basic terms, I've been able to convey to you, what the imaging is, what kinds of differences and impacts we can make in people with prostate cancer with this sort of imaging, and just how powerful a tool it is for us to manage patients with prostate cancer better. The problem is PSMA-PET imaging is currently only available in BC at BC Cancer Vancouver. There's one, even though we have PET scanners at all different places, the ability to, in Victoria, Kelowna, and Vancouver, the ability to do PET scans for prostate cancer is very specific, and we only have the equipment to do that in Vancouver. And so Vancouver, quite kindly is serving the entire province for these scans. But the problem is there's a lot of people that need these scans. And so right now, the wait list for a PSMA-PET scan ranges at about 8 to 10 months, which is a long time. In fact, it's too long.
Volume?
It's too long for most men, or for many men who have prostate cancer. A lot of times, we're getting them when we can, but a lot of times, we go without using it because, a man can't wait 10 months to make decisions. A lot of men need to make their decisions quicker, or else they may have poor outcomes because of the delay. So because of this, fortunately, the BC Cancer Foundation has started a campaign to raise funds to develop PSMA-PET imaging in Victoria and Kelowna as well. And so this has been going on since late 2020, this fundraising campaign. And so, as I said, the goal is to have it at 2 further centers, and having access in Victoria and Kelowna will really benefit the entire province. This will reduce the wait list of the Vancouver site. And if we have it in Victoria and we have it in Kelowna, we can service our, on Victoria, we can service the island, but also, we'd be able to accommodate patients from other areas of the province who don't have ready access, patients from Prince George or things like that in a much more timely fashion. So, this is a really big advancement that we're looking forward to. It's not a simple thing. Acquiring PSMA-PET scan requires some things. Fortunately, we already have the biggest piece of equipment we need, and that's the PET scanner. The PET scanner, we have a PET scanner here in Victoria, and as far as I know, a PET scanner has been installed in the Kelowna clinic as well. So the basic piece of equipment we have, but what we need is other stuff. And the other stuff, if we go back to what I showed you about how the PET scan works, what we need is this reagent. We need equipment that allows us to make this PSMA-11 molecule. That's the molecule that actually gets injected and binds to the PSMA receptor. And we also need a piece of equipment called a gallium generator, and that's the piece of equipment that gives us the radioactive gallium that gets attached to this PSMA-11 stuff. So we need those two fairly major pieces of equipment: a gallium generator to produce the tracer, laboratory equipment to produce the PSMA-11 molecule. There's also costs because this is nuclear radioactive stuff. You need a lot of regulatory hurdles that need to be that we need to get through, which costs money, and quality assurance for making all these things. And then of course we need the staff. We need staffing for it. So this is what we're been raising money for in order to obtain this. And so far this campaign is going very well. You know, lots of not just individuals, but lots of local businesses are really stepping up to the plate and helping to fund this campaign. So that's all I had to say about PSMA-PET scan. Again, you know, it's a complicated topic. I hope I was able to get across to you kind of some of the basic nuts and bolts in this regard. But definitely let me know, you know, if you have any questions. I'd be more than happy to answer them for you. Thank you.